Welcome. Come with me. The doctors will see you now.
Welcome to another episode of Fast Talks with Family Docs. I'm Dr. Phil Palmer.
And I'm Dr. Virbadala.
And today we're going to mix things up a little bit, take a different approach than what we've done before. We've heard from a lot of our colleagues that they missed the camaraderie of residency, the ability to sit down with their peers and troubleshoot difficult cases or share interesting cases they may have seen. When I entered practice back in the 90s, there was a lot of opportunity for that to still take place in doctors' lounges as many family docs followed their own patients in the hospital. Nowadays, most family docs have shifted into more of an outpatient-only type setting, and so they've lost that opportunity and the time to have that engagement and talk about interesting cases. And so we want to try and bring that back. And so today on our podcast, we're joined by Dr. Colton Want. Colton is a resident at Great Plains Family Medicine Residency in Oklahoma City, and he is a third year and will in a few months be moving to Duncan, Oklahoma to start private practice. And Colton had an interesting case and has been gracious enough to sit down with us in our doctor's lounge, such as it is this evening, to talk about this case. So Colton, welcome. It's great to have you here.
I appreciate the welcome, and the graduation is all dependent on Dr. Palmer here letting me leave residency. So
1650.
You're doing good so far. But tell us about this case. How did this lady present to you?
Yeah, so I had a 41-year-old patient come to me with something that I thought was really kind of off the wall. I'd never seen it before outside of the hospital setting. Some people present this way in the hospital, and it's a big emergency, but in the clinic, it was kind of a unique presentation. And so she comes in with just a few days to almost a week of facial swelling. She had some significant erythema underneath both of her eyes, was swollen, almost like an angioedema type picture, almost an allergic reaction. If you're just looking at her, you would think, hey, what did you eat? What did you do? This is an allergic reaction.
Or maybe like a periorbital cellulitis or something like that.
And that was the oh no, could this be type of thought there. And so that was actually something that we had discussed. So she comes in, her exam is otherwise completely benign. She's having no other symptoms. She's not having any itching, it's not significantly painful. She's a little bit tender, but just has this just profound facial swelling. And so I was a little bit perplexed when I first saw her, through talking to her and kind of getting an idea of what all had gone on, we did talk about, do you have an infection? Is this something that we need to be treating with antibiotics? Because that would be the big scary emergency, right? Especially a preseptal cellulitis, something that can end up being, life-threatening, limb-threatening, emergent type situation. And so we had discussed that a little bit, but it was just nagging at me the entire time. And I think, Dr. Palmer, you might have been precepting this
One
day.
of the times in there, I don't remember which one.
Yeah, and I think I remember telling one of you, like, this seems inflammatory. This doesn't seem like it's infectious in nature. And so, out of an abundance of caution, I told her, I feel this is inflammatory, but my big concern would be infection here because that's the thing that's going to threaten your life. And so I did say, hey, let's put you on a few days of antibiotics. I want really close follow-up. I want to hear from you in 3 to 4 days. Is this getting better? Is it getting worse? Are you having any other symptoms? And so we went ahead and put her on some Augmentin and sent her home and said, hey, I want a phone call with anything.
Yeah.
And that's kind of where we started. And so, I was talking to my attendings the day of, I can't remember if it was you or not, but we were discussing, could this be an infection? It's bilateral. It would be pretty atypical. It wasn't something that, with the constellation of symptoms that she was having, just wasn't high on my differential. Is this an allergic reaction? Quite possibly. We couldn't identify anything through her history that made us suspicious for anything specific that she might have ingested or come into contact with that was new for her.
No new makeups, eyeliners, and that kind of stuff in her history.
Secluded to the face.
Yeah, and that was the interesting thing. It's just the face, and like you said, Dr. Palmer, no new products, nothing that she'd put on her face. In fact, she very rarely wore makeup of any kind, and so it was kind of perplexing thinking about what might be causing this. But I want to circle back just a bit to her physical exam because it was a little bit interesting. She's got the bilateral erythema of the face. She's got just diffuse swelling. And for those of you, kind of on video, you'll be able to appreciate this a little bit more. But from her eyes down, it just looked like her face was just blown up.
Wow.
It spared the forehead for the most part. It was just from the eyes down. And then on, palpation of the area, like I said, she was a little bit tender, not profound. And then she did have some areas of induration, kind of just superior to the zygomatic bone on both sides. It was kind of right underneath their eyes. And I was a little bit perplexed by that. And finally, at the end of the encounter, she, I had asked her if she'd ever had anything injected in her skin, ever had anything there. And she did mention finally at the end of the encounter that she had dermal fillers about 5 years ago. And this is where the case kind of got a little bit interesting for me because, 5 years ago, that can't be contributing,
related,
right?
yeah.
Yeah, it would be completely unrelated. And so I kind of sent her on her way, and it was bugging me. It was nagging at the back of my brain there. Feeling like this was inflammatory, feeling like, we're probably not going to treat this with antibiotics. I didn't feel like that was going to be successful. And so I kind of hit the books a little bit. This is one of the reasons I brought this case. It's such a niche topic. Like, it's not something that is going to be applicable to very many patients.
Yeah.
So I really wanted to bring it with the hope that I can encourage physicians to stay a little bit curious. This is not something, not that I didn't do an up-to-date search, because I absolutely did, but it's not something that you can find on up-to-date.
Yeah.
And so I did a little bit of database research with the assistance of the library, which, wow, I mean, that's, that doesn't happen anymore.
Yeah.
I feel like I think we underutilize our wonderful librarians that can get us access to all kinds of information that we can't find ourselves. And so our wonderful librarian there at Integris got me some case studies on delayed reactions to dermal fillers.
Wow.
And so I got to reading a little bit of this and figured out that it's not quite as rare as what one might think.
Even after 5 years.
Even
5
after
years.
5 years. And I think the incidents, recorded incidents can be out to 7 years even.
Wow.
Where they're seeing cases of this. And so, the first thing to do was figure out what kind of fillers she had. So I called the patient. I said, hey, this is bugging me. I know you're a day into your antibiotics. I don't know if that's going to be helpful for you. We're probably going to end up doing something different. Tell me more about your fillers.
Yeah.
So we had to go through this whole conversation. She actually had to go find her paperwork from 5 years ago, which that's a task, and figure out exactly what type of filler she had, and ended up letting me know that she had what's called PMMA fillers, or polymethyl methacrylate microsphere fillers.
Okay.
You
No
say
idea.
that 1,000 times fast, right?
Yeah.
But that was what she had injected in order just to fulfill some cosmetic desires that she had at the time.
Okay.
And so I was kind of curious, has this happened before? And the incidence was a little bit higher than what I thought, specifically with this type of filler, but even with hyaluronic acid fillers and things like that, up to 1.9% of these patients
Really?
Wow.
can get this reaction. Interestingly, it seems a little bit insignificant, 1.9%, but just doing a little Dr. Google research, you can find 3 to 4 million people a year in the United States getting dermal fillers for cosmetic reasons.
Yeah.
And so, you compound that year over year with a condition that can present 7 years later, that's not an insignificant amount of patients.
Yeah.
And so I thought that was interesting.
So with this finding of it likely being inflammatory, did you put her on steroids, and did steroids cure her then?
Yeah, so definitely didn't cure, but we did talk after 3 days of antibiotics, no improvement, no worsening, just kind of the same presentation. I made the decision, I think we're safe at this point to stop antibiotics. I don't think this is infectious, I believe this is the point where I actually brought it to you and discussed it with you to make sure we were doing the right thing for this patient. But actually talked to her about doing a 7-day prednisone taper at that point.
So it's kind of like a delayed hypersensitivity reaction, but 5 years later?
It's really interesting
Super
because, I don't think you could really qualify it as a hypersensitivity reaction in and of itself.
Right.
The actual pathophysiology is kind of interesting. It actually begins with granuloma formation.
Okay.
And so over the course of however many years, that where the tracts where those dermal fillers were injected can actually form granuloma. And when that occurs, that in itself is inflammatory and not always a problem, but can result in this like diffuse facial swelling or wherever the fillers are placed, right?
Right.
And I actually learned that a little bit later. It's kind of an interesting case. So,
Fascinating.
so we did put her on steroids. She sent me some pictures through my chart a little bit later. Things had gotten significantly better. The erythema had resolved. The swelling was about half of what it was. But she continued to have these granulomas that were the hard indurated areas underneath her eyes.
Yeah.
And so at that point, my suspicion was this is probably going to recur. This is probably not something that one course of steroids is going to take care of. Sorry, did you have a...
No.
Okay. So I, at that point, had talked to her, and I was like, hey, this is one of those things that we may be able to get away with one round of steroids. My suspicion is we're going to need to continue to treat this, and we can't keep you on steroids indefinitely. So I need to figure out how we actually treat this. And so that required a little bit more research. And I actually had a wonderful oculoplastic surgeon that took my phone call, which is crazy these days, right? To get somebody to answer a phone call. But there's an oculoplastic surgeon here in Oklahoma City that was kind enough to take my phone call and discuss that, he had several of these cases.
Okay.
All the literature that I could find essentially had led me to believe that debridement of the area, surgical debridement, was about the only curative.
That sucks.
Intervention.
Yeah.
And so I had called the surgeon. I was like, I want to confirm this. You have vastly more experience in this area. Is this the right thing? Can I send her to you? And this gentleman actually saw her the next day in his clinic and got her scheduled for surgery. But just kind of a crazy presentation.
That's fascinating.
Yeah. You wouldn't think you'd run into.
No, that is.
Yeah. So how long ago was all of that? And do you have any follow-up from the surgery?
Oh gosh, I'm not sure exactly how long ago that was. That was.
It's been enough time. She's had her surgery already.
Absolutely,
and stuff. Okay.
So she's several months after surgery now. I think she's 6 months at least post-surgery. And I've seen her several times in clinic. The swelling is completely gone. There's no erythema. She actually, it seems to me, and I think through talking to her, retained a little bit of her benefit from the fillers because they weren't able to completely debride everything that was there. Yeah. And so she still has a little bit of that structure that she wanted. And there are a few small areas of induration, but nothing like it was. I would say, there's maybe 5% of what was there.
Yeah.
And so she is feeling great, looking great. The oculoplastic surgeon apparently is incredible because there's no scarring, there's nothing.
Wow.
It was overall a good outcome. Although anytime you're working on the face, you worry.
Sure.
Is it going to be a good outcome for everyone?
Yeah, scar tissue and stuff. But
yeah.
Doctor, I want to say that you are going to be an amazing doc when you're graduating out of here because that amount of time you took for this patient, that is inspiring, sir. I want to commend you on that. That's awesome.
I really appreciate that. Yeah. And, I think it boils down to just like I mentioned during the case, is staying curious.
Yeah.
This wasn't something that you could find on UpToDate. And for me, it was a little bit of a challenge. And so I took it that way and that, I was going to figure out what was wrong with this person and I was going to figure out how to fix it.
Sure.
But I think sometimes we get a little bit complacent, and even myself as a third-year resident at times, I know this stuff. I know, what's going on. We get a little bit complacent. We can find everything on UpToDate. Yeah. We don't need to do our own research. And, sometimes it's fun. Sometimes you get to step into a case where you have no idea what's going on. The incidence of this is not something that you're going to see very often in your career, if ever again. Yeah. And you get to do a little research and get to meet a really cool oculoplastic surgeon. And get to make those connections.
Yeah,
and
save that number in your cell phone.
No kidding. Yeah, and then now you've got this patient that, one, is really grateful for you taking all the time. Yeah. but two, and most importantly, just had a really good outcome.
Right.
And that's what's important.
That's important.
Yeah, well, we appreciate you taking your time to share this case with us and our followers. And those of you out there in podcast land, if you have an interesting case that you want to share, we'd love to talk to you about it. So you can reach out to us through the links in the show, or you can contact the Oklahoma Academy of Family Physicians, and they will put you in touch with someone so we can learn more about your interesting case. Until then, that's all we have for this episode. Dr. Vidala, see
Always
you again
a pleasure,
next
sir.
time. Thank you. Till next time on another episode of Fast Talks with Family Docs.
Thank you for joining us today. The doctors would like to see you back for another check-in. Please choose to follow our podcast, and you will automatically be notified when it's time for your next appointment.